Hello, my name is Lydia Assefa-Dawson, and I live in a city not too far from Seattle called City of Federal Way, and I serve there as a council member. I also serve at the Ethiopian Community Center as a board member and volunteering in any other capacities that I can do here in the area. Today, I am pleased to be sitting here with my friend, Asqual Getaneh, Dr. Asqual, and we've been friends since high school, so I've had a pleasure of spending a lot of time together. And right now, though, our conversations around what's going on with the COVID-19. Dr. Asqual Getaneh went to University of Washington, got her MD here, and moved to New York, and came back several years ago, maybe 2 years ago. And now she serves as the Chief Medical Director here at International Community Health Services. And so, again, what we're focusing on today is COVID-19, what's happening here globally as well as back in Ethiopia, and what we could do to help or support fighting this COVID. And by the way, it would be remiss of me if I don't mention that we are honoring the social distancing. So with that, thank you, Asqual, for your willingness to participate in this and have this dialogue here today. And so I also want to say that you do volunteer at on the health board at the Ethiopian Community Center also. And that's also doing a lot of work in multitude areas that are health related. And so I know they're also working on the COVID issue, and so giving out information, resources, and also working on supporting the people here that live here, the immigrant population here in the Seattle area. And so I do want to start by asking you about the spread of COVID, not only in Seattle or in the United States, but globally, and then also it's starting to spread in Ethiopia. So I just want you to briefly talk about that and just tell us what is going on. What do you see happening right now? So if you could just...
Yeah, and in a very short period of time since that first diagnosis in China, COVID has claimed about 500,000 lives, and about 8 million people have been infected. And that's really staggering. So in the US, the rates are coming down or plateauing in many places. However, with the recent marches of protest and opening up in many of the cities and states, we are seeing a rise in the rates of COVID-19. So that's a concern. It's a concern for us in healthcare, it's a concern for public health officials, and it's a concern for the public. We think that it is really crucial for the population to ensure that they're not exposed to COVID, make sure that they're physically distancing themselves and not engaging in any activity unless it's really important and vital to their livelihoods. Now, that's not going to be an option for a lot of people in Africa or the developing world. Now, the rates are rising in Africa, as we've seen over the last several weeks. The rates in Ethiopia have steeply risen over the last few days. And I understand that the number who are infected as of yesterday were about 3,900 individuals. And that's significant. We think the doubling rate might be about 3 days, so the numbers could increase significantly within the next several days to 2 weeks. What that means then is that it's not only going to strain the healthcare system, it is also going to have a huge impact on the economy. It's intertwined. in the healthcare system, a lot more people are going to be feeling ill, so they're going to present at the hospitals and health centers. There are very vulnerable people in the hospitals and health centers. So unless we ensure the healthcare, the health sector ensures that the folks that are in the hospital are protected somehow, then we will have infections that are acquired in the hospital among vulnerable people. So that would contribute to increasing the death rate. Having a number of people in the hospital also exposes the healthcare workers to COVID infection. If they don't have appropriate personal protective equipment, if there's a significant shortage, if they're not appropriately deployed, then they will be susceptible to infection. And the impact that it has if a healthcare worker is infected or has died from COVID-19 is much greater in the Ethiopian context, for example, or the African context than it is here, because there is a shortage of healthcare workers. There are not that many physicians. 1 in 30,000 is the physician to population ratio in Ethiopia, for example, and that's unbalanced, right? So in rural areas, there are very few physicians. In urban centers and big cities, of course, there are more, but there are also more individuals in the urban centers and big cities. So that's one outcome that could be terrible for the country. The other outcome that could potentially lead to more suffering is that in the context of epidemics, and this has been seen during the Ebola epidemic, where the health sector really focused on the Ebola, and a lot of folks did not seek care for their chronic medical conditions. So more people had complications from their usual medical conditions, diabetes, hypertension, other infections, much more than they would if there was no Ebola, for example, in that context. We're seeing it here in this country. The patients who have chronic medical conditions and they have symptoms of complications. So for example, if I'm at risk of having a heart attack and I have chest pain, I will delay my visit to the emergency room because I'm afraid of COVID and I'm not gonna go yet. So I'll wait till it's really severe, and at that point I may have significant damage in my heart muscle that I will have complications from that heart attack that I would not have had if I had gone to the emergency room early enough. The same with stroke. There's a window of opportunity of time where a person who's having stroke symptoms, if they presented themselves in the emergency room, they could get that medication and the disability from the stroke will be tempered. If they delay it for fear that they may catch COVID or there's stay-home order, then they're risking complications. And the same thing would happen in Ethiopia and other developing countries, right? So people are going to say, I'm going to tolerate what I'm experiencing right now, and I'm going to delay accessing care, and then the complications will be greater if care is delayed. So it has, just to summarize, impact on healthcare workers, impact on the economy, and impact on other chronic medical conditions or other preventable conditions, both from shortages of healthcare workers or delayed care.
And also the other factor would definitely be the infrastructure and capacity not being up to par already, and then when you have this added to everything, it makes it even worse. And we've seen that here as well. So, yeah. So as you know, well, you're a part of it, we have a task force here in Seattle to address COVID-19 and to support the effort that's being happening in Ethiopia. And so, as a participating member, what do you see the group doing? And also, how can other people support or be engaged in helping the Ethiopians, or especially the medical field, people who are dealing directly with COVID? So how do you see that this task force can do it, but also what do you see other people doing to support it?
Yeah, so it's wonderful to see a group of individuals coming together and focusing on two major areas. One is to support the healthcare workers in Ethiopia by raising funds for what they will need in order to care for patients with COVID. So these are personal protective equipments and other items that they will need, and so that's one, fundraising. The second is collecting those equipments and supplies, and taking the opportunity that there is a Boeing plane that will be flying on July 21st to Ethiopia, and hoping that we will fill the plane with all kinds of wonderful gifts to the Ethiopian healthcare workers. There's a list of supplies and equipments that the folks in Ethiopia have identified that they need, and it's a pretty comprehensive list that includes essential items to care for patients both in the intensive care unit and in diagnosis of COVID, and personal protective equipment. So we can all participate and chip in in either or both, either donating the equipments and supplies that are needed, or donating funds. We were talking about this earlier. For a limited amount of PPEs, including N95 masks and gloves and gowns, we will need about $160,000 to purchase and ship. For the ventilators, the CAT scans, the dialysis machines, and the other items for diagnosis, I think the amount of money that is needed, or donations that are needed, is going to be a significant amount. And that means that all of us have to chip in. All of us have to contribute. Each one of us has the I was going to say responsibility, but hopefully all of us will feel that responsibility. But it's the opportunity. Yeah, it's the opportunity to contribute to reducing the impact that COVID has and will have.
Yeah. Well, thank you so much. And I think to add to that, there are close to 30,000 Ethiopians here living in the Seattle area. And we have friends of Ethiopians, others that are not even part of our Ethiopian community, but that do care. And so we want to highly encourage people to participate. There's a GoFundMe account that is set up, and that information will be at the bottom of this video or this taping. But we just want to say there's no small amount that you can donate. It's whatever you are able to do. And so every little bit helps. It adds up. And like you said, if it's going to cost over $160,000 for the limited items that you listed, and not even talking about these more expensive and necessary equipment, then I just want people to consider that and support the cause. And so do you have anything that we haven't talked about that you'd like to add to this conversation before we end it?
I just want to say that there's always a concern that if I donate, if the money that I donated or the equipment that I donated is going to go to the right place. The task force has assurance by the Ethiopian government that this is going to be delivered to the centers that are caring for patients that have COVID. And as you know, in Ethiopia, the majority of the population is cared for in the public institutions. So supporting the public institutions is very critical. It is good to demand accountability, and the task force is demanding accountability and making sure that the donations are going to the people that most need them.
Mm-hmm. Thank you for adding that. That's really critical, and so I really appreciate it. So again, we end our conversation. Again, my name is Lydia Assefa-Dawson, talking to Dr. Asqual Getaneh, and we are in Seattle at the MMRTI, the Multimedia Resources and Training Institute. And thank you for listening, and we hope you participate. Thank you so much for your time.